fellow lab rats, this is Rebecca from the Lab Rat YouTube channel. In this video, I'm going to be discussing the basics of leukemias and lymphomas. Okay, let's get started. There are four major types of leukemia. Acute myelogenous leukemia, or AML, is the most common type of leukemia. It occurs in children and adults. Acute lymphocytic leukemia, or ALL, is the most common type of leukemia occurring in young children. Around 75% of all childhood leukemias are ALL. Chronic lymphocytic leukemia, or CLL, is a common adult leukemia. Chronic myelogenous leukemia, or CML, mainly affects adults. It's associated with a chromosome abnormality called the Philadelphia chromosome. And we'll talk about all of these within this lecture here. There are other chronic myeloid disorders which can cause chronic leukemia by making too few or too many myeloid cells. These are those myelodysplastic and myeloproliferative disorders I discussed in our Introduction to Hematopoietic Neoplasms lecture. So these include things like essential thrombocytopenia, polycythemia vera, and myelofibrosis. There are other rarer types of leukemias as well, such as hairy cell leukemia. Polycythemia vera is a myeloproliferative disorder that mainly affects adults in the 40 to 60 year age range. This is caused by a pluripotential stem cell disorder, so this causes all the cell lines to be elevated. So patients with this will have elevated white blood cell counts, red blood cell counts, and platelet counts. Because there are elevations in all three of these things, the blood tends to be thicker and sluggish and can be life-threatening. Patients with polycythemia vera may be asymptomatic, meaning they do not experience any symptoms. Those with symptoms may experience swelling of joints, unusual bleeding, shortness of breath, numbness, and itchiness. There is no cure for this. Symptoms can only be treated. Patients can get therapeutic phlebotomy, so having their blood removed, and can take drugs that reduce the number of red blood cells. Chronic myelogenous leukemia, or CML, mainly affects adults in the 35 to 50 year range. It is a chronic leukemia, so the onset is gradual, usually months to years. This is associated with a gene called BCR-ABL that is created by something called the Philadelphia chromosome. So around 95% of all CML cases have this. Patients with this may be asymptomatic. Patients with symptoms may have fever and fatigue, unexplained weight loss, bone pain, bleeding, and night sweats. Acute myelogenous leukemia, or AML, is the most common of all the leukemia types and occurs in children less than a year old, and then those that are 40 years of age or older. Blasts in this type of cancer can have something called Alrods, and I'm going to be discussing these on the next slide here. Patients that have AML have flu-like symptoms, fever, shortness of breath, paleness, they easily bruise, they can have unusual bleeding, and they can have bone pain. Now, when I discussed the erythrocytes and leukocytes lectures, I talked about blasts and how we can't look at blasts and tell visually what cell line they are from. The only exception to this rule is when the blasts have something called Alrods. So this is a picture of a blast that contains an Alrod. So this right here is an Alrod. So these are kind of reddish staining needle-like inclusions in the cytoplasm of myeloblasts. So they're not present ever in lymphoblasts. So if you see an Alrod in a blast, it's definitely a myeloblast. Acute lymphoblastic leukemia, or ALL, is a leukemia that primarily affects children in the 2 to 5 years of age range. This is acute, so it's an abrupt onset. Symptoms include fever, frequent infections, bone pain, shortness of breath, weakness, bleeding from the gums, and swollen lymph nodes. Chronic lymphocytic leukemia, or CLL, is a slowly developing leukemia. This picture of a peripheral blood smear is very typical of a patient that has CLL. They will have lots of mature lymphocytes present, as well as something that we call smudge cells, which you can see here. So this is lymph, this is a lymph, this is a lymph, and then this is a smudge cell. Okay? So Smudge cells are cells, likely lymphocytes, that have broken or smudged during the making of the slide for the differential. When a patient has just 1 or 2 of these smudge cells, when you're doing a 100 cell differential, it's probably not a huge deal. If there are more than that, you need to make something called an albumin smear. And for this, you add a drop of serum albumin to 4 to 5 drops of the patient's blood sample, and then make another smear, stain it, and read it. This albumin prevents fragile cells from being damaged by the slide making process, and this allows you to get a proper differential. So there won't be any smudge cells on an albumin slide, so you can count all the cells. It's important to note that you cannot evaluate red blood cell morphology with an albumin smear. Just use the regular smear for that, and then count the 100 cells on the albumin smear slide. Lymphoma is a cancer of the lymphatic system. It can include the lymph node, spleen, bone marrow, and thymus glands. Lymphoma can be in all of those areas as well as other organs throughout the body. There are 2 main subtypes of lymphoma, Hodgkin and non-Hodgkin. Non-Hodgkin lymphoma is a lymphoid malignancy of the lymphatic system. Lymphocytes grow abnormally and can form tumors throughout the body. This is, of course, is a general category of lymphoma, but it includes many subtypes, including diffuse large B-cell lymphoma, follicular lymphoma, and Burkitt's lymphoma. Non-Hodgkin's lymphoma usually affects patients 50 to 70 years of age and usually has no specific manifestations in the blood. One of the types of non-Hodgkin's lymphoma is called Burkitt's lymphoma. And I wanted to highlight this type because of the starry sky appearance of the cell. So look at the right-hand side of this slide here. See how it kind of looks like a starry sky? This is characteristic in a patient that has Burkitt's. This type of lymphoma is mostly in African countries and is associated with HIV and Epstein-Barr infection. Hodgkin's lymphoma is a malignancy of the lymphatic system. The difference between Hodgkin's and non-Hodgkin's is what you see on the right-hand side of the slide here. These are called Reed-Sternberg cells. They kind of look like little owl's eyes. These are cancer cells that are present in all cases of Hodgkin's lymphoma. If these aren't present, then the lymphoma is referred to as non-Hodgkin's lymphoma. All right, so that ends our video on a basic review of a leukemia and lymphoma. If this video helped you out, go ahead and give it a like, and please make sure to subscribe to my channel for more educational laboratory content. Until next time.